Hello, I'm Lindsey Lyle, and I'm an oncology physician assistant, providing care for people living with myeloproliferative neoplasms, or MPNs. If you or a loved one have been diagnosed with myelofibrosis or MF, it is important to know that MF can cause a variety of symptoms, some of which you may have experienced before being diagnosed and even contributed to the reason you reached out to a healthcare professional. Determining whether symptoms are related to the normal aging process, other medical conditions, or MF itself is quite difficult for many because several symptoms typically associated with MF aren't specific to MF alone. Recognizing that your symptoms may be due to MF is important and will help guide appropriate assessment by your healthcare team. We know that each person's experience with symptoms can change over time. Regardless of how long you've been living with MF, it is important to consider that the presence of symptoms can contribute to the overall categorization of risk in MF. There are 3 categories of MF risk levels: low, intermediate, or high, which are based on the number of risk factors that you have, including symptoms. This is why it's important to understand your symptoms and make sure you are communicating them with your healthcare professional, even if you notice changes in between appointments. When these symptoms are caught early on, they may be easier to manage. MF symptoms look different for everyone, so take the time to note exactly which symptoms you are experiencing, how severe they are, and how they're impacting your life. The MF Symptom Assessment Form will guide you through a self-assessment of the most common MF symptoms. Not only will this help you identify your symptoms, but also the severity of each symptom. Bringing this form to review with your healthcare professional will prepare you for a productive visit, as they are able to have a better understanding of your symptoms, how your symptoms are affecting you, and can make an effective treatment plan for you. You can download the MF Symptom Assessment Form by going to voicesofmpn.com, or you can scan the QR code on the screen. Make sure you print out the form, document which symptoms you're feeling, and bring it to your next appointment. Grab your form and a pen, and let's get started. Knowing these 3 important words will help you assess how your MF is affecting you. Symptom. Which symptom are you experiencing? Severity. How bad is the symptom? Impact on quality of life. How is the symptom affecting your daily life? As we go over the MF symptoms throughout this video, first ask yourself, do I have any of these symptoms? Then, how often and how severely am I experiencing these symptoms? And lastly, are there activities I once enjoyed but am no longer able to do so because of my symptoms? Providing an accurate assessment of how you're feeling is essential for your healthcare professional to create a personalized treatment plan for you. So try not to minimize how your symptoms are impacting you. Let's start with fatigue, which can be experienced as severe tiredness or lack of energy, and which is the most common symptom of MF. Around 8 out of 10 people living with MF, or 81%, report feeling fatigue. Given that fatigue can be a difficult symptom to describe, when talking with people living with MF, I ask very specific questions, such as, what are ways you experience fatigue beyond the typical feeling of tiredness? How much has your fatigue or inactivity influenced your daily life? Are there activities that you were able to do 3 months ago that you struggle with now? If you are experiencing fatigue, it is important to talk to your healthcare professional about how severe it is and how it's affecting your life. Write down ways that fatigue has impacted your daily activities, or even your ability to participate in exciting life events, so you can bring this information to your next office visit and discuss it with your healthcare professional. Fatigue in MF can be due to multiple factors, with a major contributor being related to the body's overproduction of cytokines. Along with the next few symptoms we're going to cover, it's known as a cytokine-driven symptom. Cytokines are a type of protein in the body that affect the immune system. When you have MF, your cytokine levels are elevated, which causes you to have various symptoms. An example of how cytokines work is when you get sick, say with a cold, and you feel unwell. It's the cytokines that activate your own immune response to fight the infection that makes you feel sick. Night sweats are another symptom driven by overactive cytokines, and we'll talk about this next. Excessive sweating during sleep is another common symptom of MF that is driven by the overproduction of cytokines, affecting a little over half, or 55%, of patients with MF. If you are experiencing an abnormal amount of sweating, answer the following questions on your symptom tracker form. Do you experience sweating that affects your sleep or requires you to change your sheets or clothing? How often has this happened in the past month? If you are experiencing sweating at night that is more than your usual amount, this may be due to your MF. Communicate with your healthcare professional about its severity and how much it's affecting your quality of life. 45%, or just under half, of MF patients experienced itching, another common symptom of MF. Have you noticed itching on your skin that is not related to a rash? Is this associated with any burning or stinging sensation? Is it difficult for you to take a shower because you feel itchy afterwards? How often? If you are experiencing excessive itching, particularly after getting out of the water, be sure to mark it down on your MF Symptom Assessment Form. Bone pain is another symptom that has been reported by almost half, or 42%, of patients with MF. MF-related bone pain won't feel like arthritis, which is pain isolated to the joints, such as the knees, hips, or shoulders. Instead, patients may experience extreme achiness of the arms, legs, or back that does not go away even with pain medication. Have you felt any deep aches throughout your body that have caused you to limit your activities? Where do you feel these bone aches the most? If you experience this type of bone pain, use this form to help paint a fuller picture of how you're feeling to your healthcare professional. Unintentional weight loss is another symptom of MF and has been reported by 37%, or over 1 out of 3 patients. Have you been losing weight without trying? Do you notice your clothes fitting differently? Have you noticed a significant drop in your weight over the past 6 to 12 months? If you have lost weight without changing your diet or activity level, write down details of your weight loss on the form and bring it to your healthcare professional's attention at your next office visit. About 1 in 5 people with MF, or 18%, experienced fevers without symptoms of an underlying infection. It's important to remember to tell your healthcare professional about any fevers over 100 degrees Fahrenheit. How often and for how long have you been experiencing fevers over 100 degrees Fahrenheit? Do these fevers generally occur at the same time each day? Use the form to record how often you're having fevers, how long they're lasting, and at what temperature during your next office visit. Concentration problems are another common symptom experienced by 30% of patients. This symptom can be mistaken for something that happens as you get older or as a part of your everyday life. That's why it's so important to keep track of how often you experience it and how often it lasts. How often have you felt memory loss, an inability to pay attention for long periods of time, or problems concentrating? If you experience any of these symptoms, there's a good chance it could be due to your MF. Communicate to your healthcare professional the severity of the concentration problems and how much they are affecting your life. Now, let's turn to MF symptoms related to an enlarged spleen. An enlarged spleen is common with MF and can be seen in up to 90% of people at diagnosis. As your bone marrow stops working properly, your spleen works harder and it can get bigger, which in turn can cause pain under your left rib. This discomfort is fairly common, with over half of patients with MF, or 58%, experiencing abdominal discomfort. Ask yourself, do you experience abdominal discomfort, particularly after eating? Do you experience abdominal discomfort with changes in position? For example, when lying flat on your back or on your left side. An enlarged spleen due to MF can press against your stomach, making you feel full faster than you did before. Nearly half of patients, or 44%, experienced feeling full more quickly than normal. Have you been experiencing a loss of appetite? Have you noticed that you feel fuller after meals more quickly than normal? Some of these symptoms may feel familiar to you, others may not. Every person with MF experiences different symptoms, which is why it's important to slow down and record the symptoms you're experiencing. Using the MF Symptom Assessment Form that we just went over together is a great way to help you and your healthcare professional come up with a treatment plan for you. Record any new or changing symptoms and bring them to your healthcare professional's attention. It may be helpful to fill out the form before each visit to help identify any changes over time. Remember these 3 words to help you identify and assess your symptoms: symptom, severity, impact on your quality of life. Once you've filled out the form, take it with you to your next appointment. Remember, any one of these symptoms can stop you from doing the things you love. If you have any of these symptoms, it is important to communicate them to your healthcare professional, and this may mean that your disease is progressing, so don't wait. Your healthcare professional can create a personalized treatment plan that may help you get back to the things you enjoy. The MF Symptom Assessment Form is here to help you do just that. Thank you for watching this video.